We've brought together here today a range of stakeholders, including, most importantly, people with dementia and their carers, but we also have health workers, service providers from the council and the voluntary sector, and academics. We want to identify local issues for people with dementia and work in partnership with them so that we can make a real contribution to improving their lives.
So today I'm going to talk about dementia and the work that is being done in Stirling to make Stirling a dementia-friendly community is very, very important. All the things that councils and that people are doing to try and improve education, improve exercise, improve vascular health, it's possible that these are some of the things that will help. For example, my daughter, every time I sit in the sofa, she pokes me with a stick. So if she keeps me doing exercise and doing all the things that really help delay symptoms, it might not stop me getting dementia, but it means it's more affordable for me to have dementia because I do it later and I'm fitter. We need to be able to gather evidence, and we need to think about not just campaigning for change in the state, but campaigning to make sure that everybody, every human being has the knowledge that they need to be able to take care of things. So I have to have that conversation today with my daughter to say, look, 30 years from now, you're maybe going to have to be looking after me with less help, even less help than people get nowadays. So you need to start planning now.
We're going to be exploring in the first part of the project this issue of the experience of neighbourhood for someone living with dementia. But what we want to do is to then build on that.
In the early days, it tended to be somebody living with a diagnosis of dementia and a loved one, usually a spouse or a child, coming along for the afternoon for some live music, for some film, for some dance, followed by a cup of tea or coffee with people in a similar boat to you. It was a very, very simple idea.
We also have a community and home support service, which is where the workers work one-to-one in the community with people with dementia, doing whatever the person wants to do. We've done things from playing golf, going swimming, going to Dobie's for lunch, just sitting having a blather, just whatever the person wants to do to keep them in part of the community and keep the hobbies and things I've always done going.
Our customers are getting older, so we've got to identify and adapt to our customers' needs.
If the community can all just do a wee bit to support people, that's brilliant. Just understanding that somebody's going to take a wee bit longer at the till, not to rush them. If a company has a really good healthy attitude and makes sure all their staff know a bit about dementia, it's going to be good for their business as well.
Okay, so I'm going to bring these statistics a little bit more to home, to a Stirling perspective. And taking the 17% figure from the Scottish Health Survey, there could be as many as 15,000 unpaid carers living in the Stirling Council area. I also just want to specifically highlight that of local carers we have registered with ourselves as an organisation, 9% are caring for someone with dementia. Considering that we have carers registered covering over 30 different conditions, this is a considerably high percentage for us.
All of the organisations here today have a vested interest, I suppose, in working together to make Stirling the place to be if you have dementia. So it gets you a bit of recognition for what we do.
I thought it was illuminating just how diverse the opportunities are for people with dementia and their carers, and I thought it was a really good starting point for conversations that might lead to future collaborations. And having the marketplace was a great opportunity for people to be relaxed, to enjoy the experience whether or not they had a diagnosis of dementia. And I felt that there was a lovely tone to the event that lent itself to including people.
So this is me they're talking to, this is about me, because it just felt so personal. And then another thing I feel is there's not enough publicity given to the things that are going on, because I wasn't aware of a quarter of the stuff that goes on. I didn't know, I'd never heard of it. But for people who are starting out, I think it could be very beneficial and in actual fact help them a bit to retain their abilities.
So to meet all the people, all the organisations that are just doing a little part, all those little parts will all join together and make something, make a proper impact. So I'm pleased we were here. We're all going to need a lot more support. So this is fantastic that it's happening in Stirling. How cool.
I work within social services in Stirling Council, but more importantly today I'm part of a multi-agency group that are working towards a dementia-friendly Stirling. for me, the information that we've had around what's going on for people with dementia in Stirling is really quite exciting. I think for the group, we're very excited by the interest and commitment of people across our community in changing the face of Stirling for people with dementia, as well as the support that Dementia Friendly Stirling can give to loved ones that are caring for people with dementia. There's a number of other projects underway that we've started. We haven't showcased today, and they're around community signage, further training within local businesses, physical changes to our environment, which include public spaces and our local parks and gardens.
I just want to say marvellous things are happening here in Stirling. It's internationally known for its dementia centre, and the work that is being done locally, that's been done for years, is just tremendous.